Hello, everyone. First of all, on behalf of ISSUP Lebanon, I would like to apologize to our attendees for postponing today's webinar twice. So thank you for your understanding and for attending. We are excited to host our first webinar of the year with Dr. Lilian Ghandour. Lilian, thank you for giving us your time to present an important topic today, prevention of drug use and other risky behaviors in youth. Lilian Ghandour is a tenured associate professor at the Faculty of Health Sciences at the American University of Beirut. She received her PhD in 2008 from the Department of Mental Health at the Johns Hopkins Bloomberg School of Public Health. Dr. Ghandour has been involved in the design and analysis of various national and international surveys on youth substance use and mental health. Her research focuses on investigating the epidemiology of young adult harmful alcohol consumption and prescription drug use and mental health disorders in children and adolescents. Dr. Ghandour is involved in translation research, conducting epidemiological studies to help generate data that would inform local national policies and practices. She has received several extramural research grants and awards for her work on youth mental health, and has published extensively in high-tier peer-reviewed journals. In today's webinar, Lilian will discuss the importance of adopting a public health approach to substance use prevention and to using epidemiological data for the planning and evaluation of all programs and interventions aimed at preventing or reducing substance use. We will be having a Q&A session at the end of the webinar, so please feel free to submit your questions in the questions box. I will now give the floor to Dr. Ghandour.
Thank you, Noor. Can you hear me well?
Yes, we can.
Thank you so much for the kind introduction and for the invitation. And I guess it's true what they say, the third time is a charm. So again, I also would like to apologize for the need to postpone this a couple of times, but here we are today, and I hope we get to have an interesting discussion. So, so as Noor mentioned, so I'm an epidemiologist and a public health professional. So I figured, you know, why not discuss substance use prevention from this angle and try to perhaps show you the clear link between epidemiology and effective substance use prevention. But I would like to spend the most of my time talking to you about our experience in the case of alcohol and the case of trying to develop a national alcohol reduction policy for Lebanon. So hopefully here we can have an interesting discussion towards the end, and I'll tell you about the process and the outputs and the lessons learned, and maybe a little bit about the ways forward. So I'll start with maybe a few lines about what are the unique features of public health, and you'll see from basically this basic introduction that there's a lot we do in substance use prevention that is very much utilizing the public health approach. As public health professionals, we focus on populations and communities, so it's not like we're providing care on a one-to-one basis, but we're trying to prevent you know, ill health in the general community, and this is exactly what most of our work in substance use prevention is about. So it focuses on prevention. It has a basis in social justice, and that too is very much linked to substance use prevention, because when we're thinking about programs, we're thinking about being inclusive. We're thinking about, you know, making sure that we reach all diverse segments of the population. And so this is basically, we're trying to be socially just. It is inherently political in nature. So public health is very much political in nature, and I think you can guess why, because all our work needs to happen within a regulatory framework, and any comprehensive, effective approach to substance use prevention would require collaboration with the state agencies and the government, and therefore there's a big role for the government and the state agencies to play. Last but not least, it is grounded in science, and so this is where I'll be spending a few moments talking about the importance of data. So we hear about data-driven planning, we hear about evidence-informed policies, and literally what we're trying to say here is that we don't wake up one morning and decide that this is the program that I'm going to be implementing because I just seem to like it. It has to be based on data and evidence that have shown that this actually works, and not just works in one community, but across several communities. So this is just basically to reiterate that substance use prevention and public health are very much intertwined, because substance use and misuse and substance use disorders affect populations as a whole due to obviously the many health and social problems that they're linked to. They are totally preventable, they're inherently political in nature, and obviously all our work in substance use prevention is very much data-based. And this shift from a criminal justice to a public health approach was very much unanimously approved in the 2016 United Nations General Assembly Special Session on Drugs, or what is the UNGAS 2016. And here there's a lot of text, but what I want to show you is basically the sort of the text that pops out, like the public health approach, right? So shift from a criminal justice to a public health approach. Continuous dialogue between policymakers and the scientific community. And what is that? That's just basically telling you that it's very much inherently political in nature, because you would want to have that dialogue with the policymakers and the policy implementers. And last but not least, public health is very much based in science, is very much science. And here you can see that in this report, they highlight the importance of evidence-based approaches to drug policy based on public health principles. So the link is hopefully quite clear. So there's a lot of text here as well, but what the 8 recommendations adopted unanimously by the member states mention is that we need to eliminate stigma and discrimination. So these are our guiding principles in public health. And you can see there's a lot of evidence-based. So obviously there's a lot of public health. So clearly our work in substance use prevention is very much would very much require a public health approach and a lot of data-based planning. This is just another example of how the APHA, the American Public Health Association, these are the various policy statements that have come out, and quite a few of them are actually talking about the importance of adopting not a criminal approach, but rather a public health approach to this issue. So what is the public health approach, or what are the steps that we normally take when we are approaching a problem or a public health issue from a public health approach? The first thing that we try to do is we try to understand the problem. So we define the problem. So how many are using, what, where, which is distribution by person, place, and time. So for example, here we could look at age differences, gender differences, differences by areas or communities. Why are they using, and so on and so forth. So you're trying to really understand the problem that you're trying to prevent. And to understand the problem, obviously you need to understand why it's happening. So this is what I mean by identifying the risk and protective factors in order to develop, and test the best prevention strategies. And afterwards, once you sort of prove that they've been effective, to try to adopt it in a more widespread manner. Now, this is the CDC. This is from the CDC. And actually, instead of substance use, they had violence. So this was an example on adopting the public health approach to the prevention of violence. But I just wanted to show you that you could pretty much take out violence and put substance use or any other public health problem and pretty much be able to use the same approach to address that issue. So epidemiology is the basic science of public health, and the reason I highlighted that is because really it's one of the core functions of public health and one of the core functions of substance use prevention. So here you can see the core functions, starting with monitoring health. So what do I mean by that? So monitoring health is basically trying to routinely collect the data that would be of interest and importance to help us identify if there are any problems. So death certification systems, so any vital statistic or registration system would allow you or surveillance data programs would allow you to detect on a continuous basis any problems that would require, for example, further diagnosis and investigation. We collect this data, but more importantly, we collect this data and utilize it in multiple different ways. The first way in which it could be used is to educate the public, and also to empower the public. You want to train and empower the public to be health literate or public health literate. We mobilize community partnerships because obviously, I'm sure all of you know that we can't, work in silos. I can't do much on my own. I can't do anything on my own. So we really have to be working together collaboratively and working within the communities with the community members in order to be able to make sure that these programs are sustainable and that they are owned by the community members. When we use the data to develop policies, and enforce laws, it's because we want these policies to be actually based on the state-of-the-art evidence that this actually would work. And I think it's not by chance that we have mobilized community partnerships before developing the policies, because I'm sure most of you who've worked in this field or working in this field, you know that for any policy to be well adopted or implemented, you need that ownership by the community members. So you need to mobilize the community partnerships before you actually try to pass a law and try to implement it. We also work on, obviously, part of the prevention, because prevention could be primary or secondary, but tertiary prevention is trying to make sure that the problem doesn't get worse. And so this is why we need to make sure that we have enough services, that these services are actually equitably distributed. So it's not like they're all centered in the city and all of these suburban areas and rural areas do not get these services. And finally, we want to make sure that we are evaluating. So here actually, I wouldn't really I don't see evaluation as a very last step. If I were to rework this diagram, I would actually put evaluation all around, because at every single step of the process, I feel you need to be evaluating your steps forward. So that you take all these little bits and pieces of data, which hopefully, these little circles are depicting, and you do the data-driven decision-making and evidence-based interventions. So this is another way of, Dr. James Anthony was one of my mentors, and I really like this very simplistic way of approaching any public health problem. And so he asks these 5 questions. Basically, first is how many? So how many have the problem of interest? Where are they situated? And where is not just by place, but person, place, and time. Why is this happening? How? And the how, I'll show you in a bit what I mean by the how. And obviously, all of these questions, their answers would lead you to see, okay, what can be done, right? And then actually, I've added a sort of a 6th, this is like from my end, a 5.5, let's say, question that says, is it working? Because most people think that once you implement something or, implement a program, that's it. But for me, actually, that's just the beginning, because once you implement a program that's evidence-based, you need to be actually monitoring this program and evaluating it in order to see whether it's actually working, or we need to be, changing a few things around. And so this is the how, basically. So the how is just basically trying to link the different components. So here you have, young people who use alcohol, drugs, or have mental health problems, maybe skipping class, and as a result of skipping class, they might have a declined GPA, and as a result of a declined GPA, they may have all these long-term outcomes. And as public health professionals and people who are interested in substance use prevention, this is important for us, because all these different steps actually highlight for us targets for prevention. So we may not be able to, for example, to change one thing, but along the way, there might be a factor that's more modifiable. So we could spend all our energy and resources into trying to address that particular. So think about it as a natural history where you can identify multiple different points of intervention. This is why we really care about the how. And so for every piece of information that you gather as a public health professional, you working in substance use, you have to link it basically to a certain outcome that is of relevance to prevention. So let me just tell you. So if I collect data on how many are using drugs and who is using drugs, right? This will automatically lead me to identifying the high-risk groups or the high-risk areas, the hotspots. So this is basically automatically a kind of a piece of evidence that would inform a policy or a program or an intervention. If I conduct studies to understand better the why, so why young people are using drugs, or what are the multiple different risk factors, this is because we're interested more in identifying targets for prevention. So this is why we've got, in a few slides I'll be showing you, we've got school-based programs, family programs, because there are risk factors at all of these different levels, and this is why they've become targets for intervention. We could also use all the data to guide decisions. So every single decision that we make needs to be data-driven. So all of this data, regardless of whether it's descriptive or analytical in nature, it will help us guide decisions and obviously evaluate impact. And to evaluate impact, we really need to be collecting data over time. So in a very continuous sort of methodologically similar manner in order for us to be able to compare across time. So these are just examples from, high level, high quality studies that have been conducted over the years and for many, many years now. And they've been used to inform the local drug policy arena and also the local, substance use efforts to intervene and prevent substance use. So whether it's from Europe or the United States, I always show my students, the beauty of having such data, and especially over time, because you are not only will you be able to monitor the changes over time, or maybe to detect new ways of using substances, or maybe detect new substances that are being introduced or used by the young people. You could also, in a way, indirectly assess the impact of any intervention that you may introduce or any policy that you may introduce, because obviously you've got the data over time. So just as an example, this data from 1991 all the way to 2019 for both cigarettes and marijuana will show you this crossover around 2009. So this might be, we could spend hours just looking at this data and trying to understand why did this crossover happen, what were the driving mechanisms, and so on and so forth. And obviously, in the more recent years, there are new ways of, taking in nicotine or marijuana. And so vaping started being assessed as of 2016. So you can see here that, for 10 more years to go, we're going to have data on vaping, and we could be able to compare and contrast. And this is very relevant, so I'll always be linking it back to substance use prevention. So this data is very important because when you gather data over time, it will help you revise and your programs and your interventions in such a way for them to continue being data-based. So I was fortunate to have been invited by the UNODC a couple of years ago when there was a lot of effort and work into updating the international standards on drug use prevention. And so this is the second updated edition. And what I just wanted to show you from this report is, again, the reiteration of some of the things that I've been talking about. So the information system, so this continuous data collection, it says regularly collecting and monitoring. So you need that regular data collection. Obviously, in order to generate evidence-based strategies and ultimately assess the effectiveness of these existing strategies. So this is, again, highly stressed by such an important report on drug use prevention, the importance of data. So there are multiple different types of prevention. We could think about primary, secondary, and tertiary, and we could also think the level. So it could be either universal programs, selective programs, or indicated programs. So universal programs are aimed usually at all members of a given population, whereas selective, they're aimed at a particular subgroup. Remember the high-risk group that we talked about, and indicated are targeting individuals who have already started using substances but have not yet developed a substance use disorder. And you can see that all of these interventions and programs could be at any level. They could be at the individual level, the family level. And here, if you sort of target, the individual or the school, you're primarily indirectly targeting all of these risk factors that are at the school level. So I just wanted to, there's a full list of these interventions in the SAMHSA report, the Surgeon General's report on alcohol, drug, and health. And here I just wanted to give you an example. So under each type of program, so if it's a universal program, you could, so they're divided by age group. So you can either think about, less than 10 years, because obviously programs need to be age appropriate. So we can't just have one program for substance use prevention that is applicable to all age groups. We need to be talking, and the games and the activities and the content information would change by age. So here you've got them separated by age group. What that means is that basically, for example, Raising Healthy Children is a universal program that is targeting less than 10-year-olds, and it's also targeting them using the family and the school levels. So here you can see, for example, I know, for example, that Mentor Arabia is working on unplugged and life skills training, and there are other also institutions in Lebanon that have brought in, adopted, and adapted these programs and have been implementing them in various settings, but mainly the school setting. So these are very important programs, and they've been shown. So these are evidence-based interventions, so interventions that have been shown to work. And it's needless to say that prevention works. And so the economics of prevention has shown that we can benefit a lot by implementing these programs. And obviously, there's the cost-benefit analysis has shown that the benefit is far more or outweighs far more the costs. But these programs, the school level, family level programs, are targeting specific risk factors here and there, need to be part of a more sort of comprehensive general framework for drug prevention. This is from the UNODC International Prevention Standards report, and this figure basically shows you the complexity of substance use prevention. So if you think this is too much, this is basically because it takes a lot of work and effort to be able to prevent substances or substance misuse or substance use disorders. And all of these programs working separately are quite important, but they need to be part of a whole comprehensive framework. And we need to be having all the stakeholders working together. So you can see here, for example, all of the ministries are listed. We can see here that all of the different levels within the community are listed, so social workers, schools, etc. But what I really want to highlight is the importance of a supportive regulatory framework and obviously financial and human resources. So this is quite important, and many of us may be working in different aspects of this diagram, but really the idea is to be working collectively and collaboratively, because only when we do that would we actually have quite a working national drug prevention system. So with that quick overview on hopefully the link, I've clarified the link between public health and EPI and substance use prevention. I want to share with you our experience from Lebanon trying to push forward a national alcohol policy or a national alcohol harm reduction policy. All right, so for those of you who don't know Lebanon, don't believe everything that you hear on the news, but this is a beautiful country, and all of these are basically real and clear pictures of the beauty of the country. And it's a tiny country in the Middle East, but it's at the crossroads of the Europe, Asia, and Africa. So we've got our own culture, but we're definitely picked up a lot on some of the Western cultures and habits as well. And so obviously I'm going to be talking about an alcohol harm reduction policy, or how to prevent alcohol misuse and alcohol use disorders. And the reason I chose to work on alcohol is because obviously, in the words of Dr. Babur, alcohol is not an ordinary commodity. It's just unique. There are characteristics of alcohol that make it quite easy and hard to work with. Its harms are preventable. It's both a public health and developmental issue, right? And if you think about it, some proponents of making all these alcoholic beverages quite accessible and available, and having all these pubs and restaurants serve alcohol would tell you that it's an important contributor to business. These are all job opportunities in hospitality and retail sectors, and obviously it brings in, if we export beverages, we're obviously bringing in a lot of foreign currency and revenues for the government. On the other hand, it is one of the world's largest basically risk factors for disease and disability. It's associated with, we all know, lots of acute and chronic medical conditions and social problems. And obviously it's got a lot of direct and indirect costs. So definitely if we weigh sort of the harms and the benefits, the harms are way, and it would be tilted even more had I listed all the sort of negative consequences for alcohol use. All right, so what my research had shown is that drinking is starting as early as, so I try to use this infographics to make it a little bit more cuter. So basically, but there's nothing cute about, starting to drink as early as 13. We have data from the Global School-Based Health Survey, the GSHS survey of Lebanon. It was conducted in 2005, and then again in 2011, and again in 2018. This is the best monitoring data we have so far on young people. And what it's been showing is that almost 90% of the participants who reported drinking alcohol had actually started drinking alcohol as early as 13. Looking at the data over time, we see that there's a rise in the number of past 30-day drinkers, and quite intriguing was the faster rise among the females. Now, it wasn't a shock to me because for most of you would know that the industry and the alcohol distributors and all of sort of the ads on TV and other social media platforms are targeting women. They're targeting young people and women. So that's why you started seeing all these sort of thin bottles of beer, and you're just trying to speak to women more. And this has translated into epidemiological data telling us that more women are actually picking up drinking. Drinking is not as occasional as most parents or maybe stakeholders think. We have data that shows when we asked our high school students in one of our surveys, how often do you drink alcohol? A substantial proportion said 3 to 4 times a week, which means that, given that we have only 2 days over the weekend, this means that they're drinking during school days and drinking more often than occasional. We have a lot of alcohol-related traffic injuries and traffic crashes, and the research also has shown that it is linked to other mental health problems, including prescription drug abuse, gambling, and also suicide. And despite my interest in quantitative data, I always feel like I really need to speak to the actual stakeholders to get a better sense of, of the matter that I'm investigating. So here, what we did with my colleagues is conducted several focus group discussions with young people, just to get their perception of things. And it was quite helpful to see that young people themselves, people who drink, these are drinkers, these are alcohol drinkers, they think that it's just too easy to get a drink. They think that it's quite absurd that no one asked for their ID when they were asking, ordering alcohol in a pub. They think it's not expensive, and believe it or not, we have what is called drive-through drinking stores. So this is basically, and most young people actually visit those drive-through stores. They buy the cheapest type of alcohol before they actually go and party in a pub or in a restaurant where the alcohol might be way more expensive. And so obviously this is clearly a public health problem. This is all happening at a time when alcohol is actually witnessing a decline in most of these developed countries such as the US and different parts of Europe. So what we did is I looked for funding. And at the time, around 2013, IDRC, the International Development Research Center Canada, had put out a call for proposal saying, we're interested in research grants that are focused on generating the evidence needed to push for an alcohol harm reduction policy for a low middle income country. And there you go, we ended up applying and getting the grant. And I put together a multidisciplinary research team. And this is quite important, and I'll come back to it later on. Obviously, as an epidemiologist, I made it sound like EPI is very much linked to substance use prevention, and that EPI is the basic science of public health, and and data is very much needed. But obviously, on your own, on my own, I wouldn't be able to achieve anything. So basically, what we did is I put together a great team of researchers and academicians that work in health policy, so you can see the need for that, health promotion, monitoring and evaluation, applied economics, because obviously if you're thinking taxation, I would need someone with those skills to be able to, study the impact of taxation on health, and so on and so forth. So, and as we moved forward, we realized that we needed to collaborate with additional consultants, bringing in, for example, lawyers, as well as ArcGIS specialists, and so on and so forth. And the point behind the grant was, or the project, is we wanted to catalyze, shape, and improve the quality of the debate in the Lebanese policy environment. Alcohol was just not on the radar, neither for policymakers nor for the most part the NGOs that are working in substance use. So they were more focused on illegal drug use rather than the use of alcohol or another interest of mine, which is prescription drug abuse. So we really just wanted to put alcohol harm reduction on the policy in order to recommend, implement, and reinforce an evidence-based alcohol control policy. And ultimately, that was sort of like the end goal, not of this project, but of the work that we are trying to mobilize within different parts of the community to reduce alcohol-related harms among the young. So for those of you who are wondering about our policy background, so in Lebanon, alcohol is very cheap. Even with the inflation that we see now, even with the dollar being at 9,000 right now, it's still very cheap. It was as cheap as water, and it's the sale to minors is unregulated. So you could be a 14-year-old that walks into a supermarket and buys booze and comes out, and nobody talks to you or would stand in your way. Drinking and driving is not. We had a new traffic law, so this was one of the achievements of 2012, but unfortunately this law is not being implemented, and there's obviously no regulation of alcohol advertising or marketing, and actually the ads are very demeaning, and they are literally targeting young people. So here you can see that if you walk into a supermarket, what I wanted to show you is that sorry, someone's talking. So the so what is that? The iced tea is right next to a vodka mix, right? So this is crazy. This is not within the WHO Best Buy recommendations. So there are effective policy strategies to reduce alcohol misuse and alcohol-related harms. And there are core ones, expanded ones, and optimum ones. And let's just focus on the core ones. So there is plenty of evidence, systematic reviews and whatnot, telling us that basically if you reduce affordability, if you reduce availability, if you regulate marketing and advertising and promotions, and you obviously have laws that ban drink driving, that you could be reducing alcohol-related harms by a lot. But we don't have that in Lebanon. And so this is just to show you that this has been proven worldwide, in Europe, in the US, and in different parts of the world. So what we did is basically adopt a multi-methods, multi-source approach. We said, okay, so we need to be talking to all these different stakeholders. And stakeholders could be basically the young people, but also people that are working in policy. So we spoke to many stakeholders from the ministries, the various ministries in Lebanon, but we also spoke to the industry, and we also spoke to NGOs active in the field. So again, those NGOs, for the most part, were thinking or were working towards drug use prevention, but alcohol wasn't really the primary mandate of those NGOs. But nonetheless, they were active, they were serious, and so we wanted their input. And so the first thing that we did was benchmark. So we thought, okay, so we know a lot about what's going on globally, but alcohol doesn't seem to be picked up, so much within the Arab world. So what we wanted to understand is, what is the situation of alcohol consumption in the neighboring Arab countries, and what are they doing in terms of policy? And so what we found is that, and so there are 22 Arab countries, and we did an extensive research to identify everything that's related to alcohol consumption, published evidence on alcohol consumption from that world. And we saw that Lebanon, like other countries, like United Arab Emirates or Jordan or other countries, where there is data that indicates that it is a problem and alcohol is not banned, the next sensible choice is to make sure that we have evidence-based alcohol control policies. So we, from the surveys that we conducted, we basically summarized them using infographics and we published them using, obviously, in academic journals. But here, what I wanted to show you basically using this infographic is that, a substantial percentage of the past year drinkers actually reported alcohol-related problems. So one of the things that one of our stakeholders actually mentioned is that, it's not enough to just show that young people are drinking, you have to link it to alcohol-related harms. And so obviously there are 50% of these drinkers are suffering from either mild to moderate or severe alcohol-related problems. The other thing that we thought of halfway through the project actually was to try to map the alcohol outlet density in 4 main areas of Beirut. So this is Ras Beirut. This is like the main part of the city. And here is this red zone here is where most of the alcohol outlets were found. And this is using GIS surveillance. But interestingly enough, this is where three major universities are, and as many as 10 schools are. So you can see that there's a very dense, dense levels of alcohol outlets right where there are young people. And so obviously this has a clear implication on policy and making sure that the availability of these places or the licensing of these places takes into consideration the fact that they are opening up next to universities and schools. My economist colleague was able to show the impact of taxation on alcohol consumption and purchasing using the discrete choice experimental modeling techniques. And we were able to show that having a blanket 20% tax would reduce basically alcohol consumption, but that having that 20% blanket tax on high alcohol content beverage might also be more beneficial in reducing alcohol consumption. Now, I want to spend a little bit more time talking about the qualitative interviews that we conducted with all of these stakeholders. So you can see the red are the ones from the state agencies. So we spoke to the Ministry of Industry, Social. So this is very much in line with that graph that I showed you from the International Standards of Drug Prevention as recommended by UNODC. So we spoke to the ministries, we spoke to the active NGOs, and we spoke to many representatives from various syndicates. And really, when we asked them about what do you think are main challenges for having an alcohol use, harm reduction policy, many agreed that it was the weak governance, the disregard rule of law by most Lebanese, and this diversion of responsibilities. It was quite interesting. So you speak to the ministries, they blame the parents. You speak to the, many of them actually blame the parents. You speak to the NGOs, they quite realize that it's the role of the industry. And the role of the ministry. So this diversion of responsibility, that's not my fault, it's their fault, was very much clear in our interviews. But I wanted to show you also the clear industry resistance to change. So notice here we spoke to the Syndicate of Alcohol Importers, we spoke to the Syndicate of Alcoholic Beverages, and the Syndicate of Owners of Restaurants, Cafes, Nightclubs, and Pastries. And it was so funny because they kept arguing against the most effective policies that have been shown by evidence. So saying things like, oh, well, if we ban advertising, that's not going to be effective. When clearly, colleagues at Johns Hopkins and worldwide are clearly showing the clear link between advertising, promotion, and substance use in general. They were like, we need to be promoting responsible drinking. So that drink responsibly is very much an alcohol industry lovable statement. We should be promoting self-regulation. And things like, labeling of alcoholic products will not be effective. Taxation is not going to be effective. And just, a few minutes ago, I showed you that statistically it has been shown to be effective. And so we should be focusing on corporate social responsibility programs. So obviously, there's a clear industry resistance to change and to implementing what really works. So I wanted to show, so the title of this talk was Using the Public Health Approach to Developing a National Alcohol Control Policy in an under-resourced setting. So this is a paper that we're putting together to send out. We felt after all this work that it was really maybe helpful from a knowledge sharing perspective. And I know you on the ISSUP website, you've got that tab that says knowledge sharing, and I'm all for knowledge sharing. So here is just our way of basically sharing our experience with pushing forward an evidence-based alcohol harm reduction policy for Lebanon. So the first thing that we did was identify the problem, we described the scope of the problem, we tried to understand international evidence and standards, and we created a multidisciplinary team and advisory group. So I didn't spend much time talking about the advisory group, but really those consultative meetings were so important. We held them once every month or two, and we had representatives from various NGOs, active NGOs, and ministries, and honestly, it was just like every step of the way, we would be very transparent with our tasks and activities and just get them to tell us, what they think about what we were doing. And once you create that team and you create your advisory group, you can expand the description of the scope of the problem, and then you can start collecting your data. So we did a multi-methods, multi-source approach. So obviously there was a quite, we spent a lot of time triangulating these data sources. I'm going to show you in a bit how we did that. And then we disseminated. And here when we disseminate, I know we're a group of academicians working at the university, but we wanted to really disseminate and different shapes and forms to get to all the different various stakeholders. So we disseminated on media, we disseminated using infographics, we disseminated in peer-reviewed journals, we disseminated in policy briefs, and so this was important because we really wanted to share the data and information with a variety of stakeholders, and not just academicians picking up a published peer-reviewed journal article. And we use the data to propose evidence-based recommendations and ways forward. And right now we are in the process of sending in another grant that would help us evaluate some of the evidence-based strategies that we came up with from this project. All throughout, we did monitoring and evaluation. All throughout, we were disseminating. All throughout, we were building partnerships and strengthening existing ones. And we were continuously sensitizing stakeholders because it was quite interesting when we thought that, oh, it's as simple as just generating the evidence and basically talking to the stakeholders and pushing forward an alcohol harm reduction policy. We realized that, no, we need to take a few steps back and just talk to them about why alcohol is a problem. Because while it's quite clear for you and me that it is, for many of the stakeholders that we met with, it was just like, what's wrong with alcohol? Just leave them to drink. They're happy. It's just a way. It's just their way of coping with everyday issues and everyday problems. And so I even had like one of the TV channels come in for an interview, and as I was talking, she paused the video and she said, "Really, alcohol has been shown to be linked to cancer and and to affecting the brain and early development?" And I was like, yes. So even the person that thought she was coming in to interview me about alcohol being, a harmful risk factor, didn't quite know that it's actually linked to many, many other diseases than most people know. Cancers, cardiovascular disease, and so on and so forth. So I will end my presentation with some success elements that I felt are worthy of mentioning. So the multidisciplinary team. Honestly, any project, any substance use prevention effort, you need to have your team as solid and as diverse and as multidisciplinary as possible. This would not have been successful without their expertise and their experiences and their input. We learned a lot from the tobacco experience as well, because as you know, Lebanon passed a few years ago a law that bans smoking in public spaces. So we are learning a lot from previous experiences and these people's expertise. The other element of success is following a participatory-based approach. So this is one of our consultative meetings. We've got representatives from Mentor, from Minara, from Kunhadi, from all these active NGOs that are working in the field of substance use prevention. And even though their mandate or their primary focus wasn't alcohol, they were ready to jump in and provide their expert input and their help in moving this forward. Mobilizing allies in the community. So one of the sort of bifurcations that this project took was meeting with NGOs and talking a little bit about CSR with them, so corporate social responsibilities. There were NGOs that were working against or for substance use prevention, but their reports and their handbooks were actually subsidized and sponsored by alcohol distributors. So they had Almaza, Heineken, and so on and so forth. So they had events that would basically promote safe after party driving back home, but that would be sponsored by an alcohol distributor. So we had these discussions, and it was very enlightening for us and for them to be having those discussions. So you mobilize allies and you start talking about things that were probably not on your primary agenda. You engage stakeholders. So we had a policy dialogue meeting where we sensitized all of these stakeholders about the alcohol. We had representatives from various ministries here, and it was a quite successful event. We disseminated, like I said, in various formats. Policy briefs was one of them, where we highlighted the importance of these elements, because I know many of you are working at the level of schools and family and communities, and this is by no means belittling any of these efforts, but we need to be implementing them within a sort of a supportive policy framework. We sparked the media interest. We engaged with scholars, both local and international. Any meeting that was relevant to our work, we tried to present the data, to discuss the data, because we learned so much from the data that we shared. This is just basically showing you how difficult and yet important it was to triangulate the data from the different sources. So here you can see that what we did is that we described the policy background, and then we described the consequences, and then we had, we presented some solutions. This was one way of being sort of ready for any media intervention or any post on different social media platforms. There are opportunities to help us make this work. There was an interministerial substance use response strategy for Lebanon that was developed in 2016, and obviously it targets different domains. One of them is monitoring and surveillance, and the other is leadership and governance, which is very much in line with what we need for an effective substance use prevention. We have momentum. We have local NGOs that are working on drug use prevention. Here you've got Mentor Arabia doing so much with adolescents in schools, with parents. We've also got other NGOs that are working on drug education for youth and parents and so on and so forth. We've got the global momentum. WHO has asked its 193 member states to make sure that they are working towards an alcohol harm reduction policy for their country. There's the Global Alcohol Policy Alliance. There's SAFER. There's the SDGs. With lots of targets related to alcohol. So there's that global momentum now, the same one that we had for tobacco quite a few decades back. But there are challenges. So I know I showed you that beautiful image of my country, and now what I want to show you is that my country is going through a lot of competing health issues, right? So there's the revolution, there's the August 4th Beirut blast, there is the pandemic, and you can see that the streets are quite empty. And so it's really hard to conduct, to be pushing forward, your original agenda on substance use prevention when there are other issues taking precedence. There's also the alcohol industry that doesn't stop working and is always lobbying for more initiators. Alcohol is a very sensitive topic. You can understand why, but yet it's socially acceptable, so it's quite hard to tackle it the same way we tackle illegal drugs. There's the unsustainable research funding. So all of these beautiful surveys that I showed you, whether it's the MTF or others, they are, there's government funding for these surveys, and yet all the research and the evidence that we've gathered has been on initiatives such as mine and other academicians in seeking grants and getting funded. So again, this is just to show you that for to be able to be successful, you really need a supportive regulatory framework. You need scientific evidence and research, and so all of these are elements of success. There are more challenges actually, and I don't want to sort of the same sort of momentum could be a double-edged sword in the sense that you have high-level agencies that are still perceiving alcohol industries and alcohol distributors as allies rather than kind of like the enemy. And so here this might send in sort of the the wrong vibes or messages, and so we need to be working more collectively to make sure that high-level health agencies are get to perceive basically the alcohol industry as bad as the tobacco industry. And so here there are lots of articles out there that are talking about the vested interests of and corporate interests of the alcohol industry, and why do we see those different from the tobacco industry. My last two slides, ways forward. I think we need to be gathering more data, but a different type of data. So we don't need more small-scale epidemiological surveys. We need to be setting up continuous data monitoring systems. We need to be making sure that we are transparent in our data sharing, something that we really need to work hard for. And we need to be continuously mobilizing allies in the community and bringing together these stakeholders so that they can work together more collectively. And with that, I will say that the road is long. And even though basically right now, maybe my country and other nations of the world are going through competing health priorities such as the pandemic or the financial crisis in Lebanon, or still the repercussions of the blast. There isn't a better time for public health and substance prevention to be working hard than now, because obviously all of these things that I mentioned are macro level risk factors for substance use, misuse, and substance use disorders. Not to mention that they prevent those with substance use disorders from seeking the help that they need and the care that they need. And so I don't think that these competing health priorities are, can be an excuse for us to stop working and to do so collectively. So thank you very much for giving me this opportunity, and I'm glad I've left 10 minutes for questions.
Thank you, Lilian, for a very insightful webinar. I'm sure everyone benefited, whether you're in the field or not, benefited in your tips, whether you're a mother, you're a parent, you're a professional worker in the drug demand reduction field. So thank you so much. We will move on to the Q&A session now. We received a lot of questions, so thank you so much for everybody who submitted their questions. So the first question is, after conducting a preventive session or workshop, how can you make sure that it was actually beneficial, besides using a pre-post test?
So I wouldn't recommend just a pre-post test. I would definitely recommend a qualitative way of collecting the data. And by that, you allow the participants to engage in deeper discussions and let you know basically what worked and what didn't work. So this is basically what we try to do. I don't think we ever assessed any of our consultative meetings or our sort of advisory meetings quantitatively with a pre and post test. And as an epidemiologist, I love pre-post tests, but this is not, they're not useful in this sense, because you really need to understand from the participants really whether they thought the prevention session worked or not, and what things would they have done differently and what things would they have done similarly. So I highly recommend engaging in in-depth discussions with the participants to try to figure out basically the details of what worked and what didn't work. Pre and post sessions are quite important when you are administering something at a sort of a large scale level and you want to sort of compare or maybe see or detect any changes in attitudes or behaviors or perceptions. But I think if you're trying to really build something and gain feedback, the qualitative approach would be more helpful. I hope that answers the question. You're muted, Noor.
Thank you, Lilian. So moving on to the second question. Between epidemiology and etiology, which one is more important while preparing an intervention with youth?
Etiology? What's the other one? Epidemiology, and what's the other field? You're muted, Sorry.
Yes, yeah. Etiology, A-E-T-I, yes.
Okay, so etiology is the source of understanding sort of the reason behind things. So unless I'm missing something, and that's a discipline on its own, but etiology is basically, so understanding the etiology of public health problems or substance use is one of the steps of epidemiology. So I don't have the, so what epidemiology is basically understanding the distribution. So, how are things distributed in the community? Like I spoke, so in order to be detecting, for example, high-risk groups and high-risk areas, and determinants. So etiology is one of it. So basically, one component of epidemiology is understanding etiology. So why things are taking place and what are the causes. So you notice that I didn't use the word cause here. And it's typically, used in basically, in infectious disease or communicable disease epidemiology, because obviously you've got your virus and it causes the disease, and it's a simple format. It's like a one magic bullet format. For us, with substance use, obviously it's a multi-level problem, and so the etiology is very complex, right? So etiology is one of the components of epidemiology, but epidemiologists also try to see to understand distribution, determinants, and also develop strategies for effective prevention. So it's I would call it like one of a whole, unless etiology is a discipline that I'm not aware of.
No, I think you're correct. I think this is what the person who asked the question meant. Okay, so the third question is, what's the difference between primary, secondary, and tertiary intervention strategies with the ones you mentioned in your presentations, such as the indicative, targeted? Yes.
Good question. I'm excited to hear about these questions. Okay, so the primary so there are different ways of looking at the problem or at the issue of substance use. So when you think about primary, secondary, and tertiary, you're thinking at what level of the disease progression or what level of the problem are you targeting. So primary prevention deals with the prevention of the risk factors, right? So you're thinking about all of the reasons why people might start using drugs. So you're trying to target those. You're trying to modify, and obviously you're targeting the modifiable ones because some are not modifiable. So so you're trying to prevent the risk factor from actually happening. So ultimately you prevent the outcome, which is substance use. When you're thinking about secondary, you're thinking about preventing the progression. And so this is why you hear me going back and forth between prevention and harm reduction, because while people might be drinking, if they do drink responsibly, and I don't like to use that word because that's more of an alcohol industry statement, but if they do drink occasionally and they don't they don't binge drink, they don't drink while driving, and so on and so forth, they're drinking in a way that wouldn't potentially cause harm, right? So, but still, our work in secondary prevention is try to prevent them from being responsible drinkers, again, quote unquote, too harmful drinkers, right? So we're not preventing the alcohol, we're not preventing the initiation. We're trying to prevent them from actually, becoming, heavy drinkers and so on and so forth. And last but not least is tertiary prevention, and that's more of like, when somebody has a disease or somebody has a disorder, and you're trying to really make it all about quality of life, and you're providing rehab for this person to try to help them quit and to provide them with the best services available. In terms of universal, indicated, and targeted, it depends on who in the community are you targeting. So are you targeting, so regardless of whether they're primary, secondary, tertiary, are they a universal? So are you targeting everyone in the community? So a policy, for example, would target everybody, right? So whether you're a drinker, a non-drinker, someone who's been abused, someone who's lives in dire family circumstances, regardless of your situation, this policy will affect you. Indicated and selected are sort of, no, you're sort of trying to address, so you go to high risk groups, right? You go to maybe vulnerable populations, and you try to make sure that those people don't use drugs, or those people don't excessively drink, and so forth. So it's a very good question, because primary, secondary, and tertiary has to do with the disease progression. When do I intervene? Versus universal, targeted, and indicated has to do with who in the community am I working with, am I trying to address?
Thank you, Lilian. It's actually a very good question, and thank you for clarifying. Now we know that youth spend most of their time using tablets or their phones. They're always online somehow. So how effective is using social media as a platform to be used when preventing youth from risky behaviors?
So we had a discussion with, we're beginning to think, we have begun discussions about this basically a few months back. With everything being now remotely done, right? Some of our substance use strategies, substance use prevention strategies are sort of maybe on hold, or the sort of the typical activities are on hold. So, for example, at AUB, we started to think about, how could we use an online or an the online platform to try and reach out to students, staff, and faculty, because obviously I'm focusing on youth substance use. Obviously, substance use knows no age group, right? It's a problem that cuts across all age groups. So we thought about how we can use, the social media platform or the online platform to our benefit, in a way where we could start engaging maybe the students, the faculty, and the staff. We even thought about maybe thinking about those effective programs and trying to maybe translate them into online platforms, or using apps or using social media platforms to try to reach out to also the parents, right? Because a lot of the issues right now that are happening globally when it comes to COVID and the pandemic and the lockdown means that the parents are at home, the work's happening from home, the young people are at home, and so all of these, may be triggering negative coping mechanisms, including substance use. And so we thought maybe we could, and we had discussions also with colleagues from UNODC. We spoke to Mentor, where we have memorandum of understanding with Mentor as well. And so we started those discussions of how we can use the online platform to reach these various stakeholders, including and mainly the families. So my interest is in the parents, trying to reach the parents through these different platforms in order to make it sort of an effective way of I think you disconnected. Am I on my own?
Oh, I'm here, Lilian. I don't see you. I think your video, I can't see you anymore, but I'm here. Now I can see you. Okay, we're back. Okay.
So to answer the question is, many of these effective programs were not built to be delivered online. And so whether it's us at AUB or other NGOs, and you can correct me if I'm wrong, and other, I know UN agencies, whether it's UNODP or UNODC, we're working quite fast in trying to see how we can make those same programs, effective programs, available through online platforms. And that's a very good question, because what if we don't go back to face-to-face interactions anytime soon? What happens to all these effective programs and interventions? So there are plenty of discussions going on, I know now, on many different levels.
Yes, you are right, Lilian. I would like to add on you that these programs are usually given in a school-based environment and live. And for those who don't know, Mentor Arabia is the official host of ISSUP Lebanon, and this is something we are. It's a challenge that we have internally, and we are hoping to move at least some of our programs online, and it's basically our priority for this year. So moving on to the next question. I think this question was asked by someone who from Lebanon. How can we change the mentality of our community concerning to strong linkages of alcohol with other psychoactive substances such as heroin? Our community shows positive concern about alcohol, and that alcohol has no sign of progression towards other harmful drugs.
Yes, very good question. I know this is what I meant by alcohol is a very sensitive topic and yet a socially acceptable substance, and which makes it very hard to tackle in a community such as Lebanon. It's sensitive because basically, as you know, Lebanon is comprised of a mosaic of religions and faiths, and so alcohol is prohibited by the Muslim faith. Whereas it's not prohibited by the Christian faith. But although my data has shown that, they're both equally, once you're a drinker, you're equally likely to develop problems. So religion does not predict at all whether you become or you develop an alcohol use disorder. But having said that, talking about alcohol on the social media is tricky, right? One time I went on a TV channel to talk about the research that we were doing. And then maybe like a few weeks later, this is let's share an anecdote with the participants. A few weeks later, I was actually at trying to fix my cell phone, and I walked into this small shop randomly in Hamra, and I was like, this area next to my house, and the guy kept looking at me. He's like, I know you from somewhere. I know you from somewhere. Obviously, I didn't give him much attention. He's like, oh, I remember now. You're that lady that's trying to prohibit alcohol in Lebanon. Are you trying to make this a country where there's no? And so it was quite interesting because I had spent my time on TV really talking about alcohol harm reduction, about reducing, car-related injuries related to alcohol. I was not talking about prohibition, but somehow it got picked up as prohibition. And nowhere did I even mention the word, prohibition or abstinence. I was talking more about harm reduction. And so people the question is very important because people get to hear what they want. And so it's not really, and so there's going on TV obviously isn't, so while spiking the media interest is important and engaging the media is important, I think we also need to train the media on how to ask questions, on how to probe, because sometimes you're trying to sort of talk about something important, and then the journalist cuts you off, and then the obviously the viewers are left wondering what so I don't quite understand what they're saying. So yes, and so the reason I say this is because the media is your channel if they're trained in proper interviewing. And luckily we have some really professional media platforms here, but if they know how to train, this is the way to reach the public and to let the public know that alcohol is problematic, that it is linked to heroin, it is linked to prescription drug abuse, and God forbid you mix those two together, you could pretty much die, literally. I mean, this is what I keep telling young people, that if you mix barbiturates with alcohol, you could slow down, your heart rate to the point where you could actually make it stop. And so this is a very important point. We need to be doing more as active NGOs, and all these stakeholders need to get up and talk about more the sort of the negative consequences of alcohol. And we can do that through the media and training the media, on proper interviewing.
Yes, I agree with you, Lilian. Thank you. I will be moving on to the last question now. In your opinion, what can we do with the lack of data, especially in the region, in Arab countries specifically?
Yeah, so we addressed that in the paper, and if you want, Noor, I can share with you, these. I know you have a knowledge sharing platform, so I can share with you some of these articles that I alluded to that are in the presentation. And the presentation, I believe, is going to be publicly available. So if they click on the links, they can automatically go to these articles. So that article that we wrote about alcohol in the Arab region, we make recommendations based on what should be done next. And so obviously for the countries where there is no alcohol ban and there is lack of data, right? The obvious choice next is to generate that data. Now, it could be a bunch of things, actually. It could be that this country doesn't have maybe researchers interested or focused on substance use. So sometimes it takes you need the human resource, you need basically the researchers, you need academicians interested in that topic. So it could be that. It could be the difficulty of getting funded. Alcohol right now is not like you don't, and right now, you know how like you go through, funding agencies go through bouts. They fund HIV for so many years, and then it was Syrian refugees and the refugee status, between 2010 and 2020, and now you seem to see that all the funding agencies are interested in COVID and mental health, COVID and substance use, COVID and NCDs, right? So now it's like the COVID area. So, but getting funds is one of the main impediments for pursuing proper research, right? And even if you get like $20,000, $30,000, that's not enough to be conducting a nationally representative survey. This is why I said that some of the most successful surveys and research is government funded. You have to have the political commitment. You have to have a proportion of the government funds allocated towards research so that it's sustainable. So that if Lilian leaves the country and decides to, relocate, the alcohol group or the alcohol, let's call it, the momentum to produce alcohol harm reduction policy doesn't stop. It shouldn't be about the person. It shouldn't be about this one or two people working on this. It should be. That's why I said mobilizing enough people within the community to be pushing forward this agenda is important, so that if you leave and if I leave and if a couple of the players leave, the agenda is still there and it's being pushed forward by others. So the way to do it is to make sure that you have academicians interested in this topic, in alcohol, and to make sure that you have enough funding, and that's it. That's pretty much it, because obviously there is no alcohol ban. So there's for the countries where there are no alcohol bans, you could pretty much generate the data. For countries that have an alcohol ban, that's a more complex question to
answer. Thank you, Lilian. I will wrap up the session now. Thank you all for attending. Lilian, thank you for your time, and thank you for an insightful webinar. for the professionals in the drug use prevention field in Lebanon, please apply for a free membership on ISSUP's website to stay updated with the latest information and follow us on our social media platforms to learn more about our future activities. Thank you, everyone, and have a good afternoon. Lilian, would you like to say something before we end our session? Lilian, would you like to add something before?
No, thank you very much. I want to thank you for inviting me and hosting me, and I want to thank the participants for their great questions.
Okay, great. Thank you. Thank you. Have a good afternoon.